Carbonic anhydrase inhibitors. They are weak diuretics. The drug acetazolamide comes under this category. Carbonic anhydrase inhibitors acts on the proximal convoluted tubule of the kidney. Let us see its mechanism of action in detail. The luminal membrane of the proximal convoluted tubule cells contains sodium hydrogen, that is Na plus H plus exchanger. In the tubular fluid, sodium bicarbonate, that is NaHCO3, dissociates into Na plus and bicarbonate HCO3 minus. Sodium enters the tubular cell via the Na plus H plus exchanger in exchange for H plus, which is secreted into the lumen. The secreted H plus combines with bicarbonate to form carbonic acid H2CO3. At the luminal border, carbonic anhydrase enzyme converts H2CO3 into CO2 and H2O. CO2 diffuses into the tubular cell. Inside the cell, CO2 again combines with water to form H2CO3 in the presence of intracellular carbonic anhydrase enzyme. This H2CO3 then dissociates into H plus and HCO3 minus. The H plus ions are reused in Na plus H plus exchange and the HCO3 minus ions are transported into the blood. Thus, bicarbonate is effectively reabsorbed. This maintains acid-base balance. The carbonic anhydrase inhibitors like acetazolamide inhibits carbonic anhydrase enzyme on both the luminal and intracellular sites. This leads to reduced conversion of H2CO3 to CO2 and water. The CO2 diffusion into the cell is reduced. Intracellular formation of H plus ions decreases. So, it reduces the Na plus H plus exchange, leading to reduced sodium reabsorption. The bicarbonate reabsorption is also reduced, leading to its increased excretion. Hence, carbonic anhydrase inhibitors causes increased excretion of sodium, bicarbonate and water. This leads to alkaline urine, metabolic acidosis due to bicarbonate loss and mild diuretic effect. Moving to its uses, it is used in glaucoma, where it decreases the intraocular pressure by reducing aqueous humor formation. It is used in acute mountain sickness. They cause metabolic acidosis. They are also given to alkalinize urine and in epilepsy as an adjuvant. Now that we have seen the uses of carbonic anhydrase inhibitors, let us move to the adverse effects. Metabolic acidosis is the most important one. Hypokalemia results due to increased sodium reaching the distal convoluted tubule, which leads to potassium loss. Renal stones may occur because alkaline urine promotes precipitation of calcium phosphate salts. Hypersensitivity reactions like skin rashes, fever, etc. can occur because carbonic anhydrase inhibitors are sulfonamide derivatives that trigger immune-mediated allergic reactions. Paresthesias are due to metabolic acidosis altering nerve excitability. This leads to tingling sensations in the extremities. Fatigue and abdominal pain may be seen. Carbonic anhydrase inhibitors are contraindicated in liver disease, sulfur allergy and metabolic acidosis as it will worsen it. And that wraps up a high-yield overview of carbonic anhydrase inhibitors.